Dr. Tam, just what's your recommendation on masking at this point in the pandemic?
Well, we know that layers of protection, when done consistently together, can reduce transmission and spread. As I said in my update, we're at a relatively steady state now in terms of cases, hospitalizations, and quite low levels of ICUs and death, which puts us in a relatively good position. However, COVID is still very prevalent. And so you can look at wastewater surveillance, you can look at the other lab tests, and over 3,000, I think, people are still in the hospital each day as with testing positive for COVID, which means that, I think depending on your risk factors and personal circumstances and the context of which you're gathering, for example, it's still recommended that you take precautions. And the NACI recommendation on booster doses for the highest risk. Those will continue then to help keep the spread of infection more manageable. I certainly expect as we move into the spring and summer months, and certainly in the outdoors, people should enjoy, doing much more, and may not need to mask under those circumstances. But I certainly think that people should be very well tolerating people who want to wear a mask, because you don't know the circumstances behind each individual's situation. So I don't think there's many circumstances in this country at different levels of government where masking is mandatory, but I think it's still recommended.